Hello, Dr. David Ostreicher. So great to have you on Thrive Live 2021. Thank you for joining us.
Well, I am certainly excited about this whole thing. I really am, and I'm proud to be part of it.
Yeah, I know it's great, and we love what Henry Schein has put together here for today. A great group of experts. Your background, your specialty is orthodontics. My first question for you, David, is why orthodontics coming out of dental school? What turned you on? What got you excited? And maybe on the look back, how you feel about your specialty, and we'll talk about where it's going.
All right, great. Well, if you had asked me when I was 9 or 10 years old what I want to be when I grow up, I'd look you in the eyes and say, I'm a dentist. Not I want to be a dentist. I'm a dentist. My dad was a dentist. He practiced in Jackson Heights, Queens. And every Saturday he used to take me to his office and he paid me to help him out, like $1 a day. I don't remember what it was back then. And I helped him sterilize his instruments, which basically meant putting them in a thing of hot water. And I helped him to mix the plaster, and I helped a lot of things. And when you ask me what I want to be when I grow up, I say, I am a dentist. And so that was it. Then a problem happened in my sophomore year of dental school. I realized I can't stand blood, and I never extracted a tooth in my life. When I was in dental school, the rotation in oral surgery was you just volunteered. Okay, who wants to pull this tooth? And I used to stand in the back. So I'm like the cop that never pulled his gun. I'm a dentist who never extracted a tooth in his entire life. And just orthodontics was for me. Everybody tells me I'm immature, so I guess that went well with kids. Back then, your orthodontic practice was 98% kids. Right. It's changed quite a bit since then, and I still appreciate it. But it was a natural for me.
Right. And today your orthodontic practice is both children, but also adult therapy, correct?
Yeah, I mean, we're 25 to 30% adults at this point.
Right. So when we look at the new technologies, and especially aligner therapy, over 20 years ago, that was brought forward. And now as it's evolving with all the new companies and new technologies, how has this impacted your practice?
It's changed it entirely. Again, we're talking, 20 years or more ago, orthodontics is a child specialty. Adults just didn't want braces. They didn't want those ugly metal train tracks. They just didn't. And then 20 years ago, there was this one company that changed orthodontics forever. And I was an early adopter. I started in 1999. I was one of the first people to start integrating aligners into their workflow. And since then, everything has changed. It just keeps getting better and better. More and more adults, more and more people. I had patients in the 80s, several patients in the 80s. That's how things have happened. And I would say first it started by aligners. And then what's happened is the technology involved has gotten so much better. And the digital workflow is such that it's easier, better, and faster to treat adults and children now.
Right, exactly. And so when we look at some of the new techniques, and I know the amazing aligner therapy through Reveal and Henry Schein, how have you integrated Reveal into your practice, and where do you see the benefits for your patients?
Well, as an aligner therapist, as somebody who does a lot of aligners, there are certain things that we know are problematic. There are certain things. And people used to complain about certain things. One of the biggest things that they complained about is attachments. They came to us because they didn't want anybody to notice their orthodontic treatment.
Right.
And one of the problems with aligners is they can only push. They can't pull. Aligners are pushing machines, basically. So when you want to extrude a tooth, rotate a tooth, things like that, it becomes more difficult. So there were attachments. And over the years, you know, for 15 years, one company absolutely dominated the aligner sphere. But what we've all noticed is that the number of attachments has kept going up and up and up and up and up. And that's one of the problems that we had. Another problem that we have is that a lot of adults, especially, but also kids, they don't take their aligners out of their mouth when they eat. They're drinking coffee, sipping wine, drinking sodas, whatever. And the aligners all the old aligners discolored. And that was another problem. And Reveal handled both of those. So as this product that their aligners are made out of something called clearware. And it really is. It doesn't discolor. You can, and they've done experiments, and it's easy to see. If you take the other aligners from other companies and you soak them in red wine or coffee for a couple of hours, they come out, they're all discolored. And the Reveal with the clearware is not. And that's a major advantage. Plus which, the original aligners and most of the other competitors are scalloped. They follow the contour of the gum line somehow, and they're all scalloped. If you look at them, you'll see they're scalloped. And that causes lots of problems. Number one, because they're scalloped like that, they become little knife edges, and it begins to annoy the patients. And then the other thing, because they're scalloped like that, they don't grab the neck of the teeth as well. They don't grab the interproximal areas. So they can't really twist the teeth or pull them down or extrude them. Reveal is trimmed totally differently. They're trimmed straight, which not only makes them more comfortable and a better trim and a better fit, it decreases the number of attachments. So that was another major thing. And when you compare Reveal to the other companies, they're the only ones who seem to have that. But that, again, major advantages.
That's fantastic. Fantastic. So in your own practice, when you think about the digital workflow, you must have a full team from a standpoint of the ability to scan, and then from there, work with Reveal, where they're doing the designing and the manufacturing. What have you learned over the course of, let's say, the last decade from a digital workflow standpoint that is advantageous for the high delivery of care that you're offering your patients?
Well, when I started this back in 1999, and every patient had to take the PVS impressions for. And I remember I was a lecturer for the main competitor, and for many, many years. And they came out with this great new scanner, which was the size of a R2D2 or something like that. A big fan in it. It was a big, massive thing. And the price of it was like between $65,000 and $70,000. And they said, because I'm a KOL, Dave will give it to you at our cost, which was $55,000. And I really hesitated. I said, how long does it take to take a PVS impression? 2.5 minutes? It's 92, it's 5 minutes. What's the big deal? Dave will give it to you for 45. So I bought one. It was this big monster machine. And it was great. It was a great investment. Patients hate the gooey, gloppy stuff. You don't have to wrap it up and mail it to the company. You want the scanner. I mean, since then I bought 2 brand new ones. And they're only like in the 20s now, so you probably get them for a little bit less. Major advancement. I just can't see going back to the other way. I mean, if somebody needs a refinement, it's nothing. There are lots of guys who do aligners who are afraid of refinement. They feel that they haven't succeeded unless they do, if they have to do a refinement. I look at refinement as part of the treatment.
Yes.
If I'm going to drive from my place in New York to California, I'm going to have a roadmap, maybe Google or something like that, but I'm going to know pretty much how I'm going to get there. I'm going to have a plan to get from here to there. But along the way, if there's a traffic jam, I'm going to change my plan. If along the way, I see something over there I want to take a look at, And along the way, I decide I don't want to go there. I want to go somewhere else. I can do it. It's the same thing with aligner therapy. When you do a treatment plan with Reveal or any other, that's a plan. That's a treatment plan that you're starting here. You want to get there. You could change it anytime you want. So
Right.
I'm not afraid of refinement. But here's the thing with refinement today. Refinement is nothing. Somebody comes in. First of all, you don't get charged. You know, if you use Reveal Plus, you get 3 years of unlimited refinements. Somebody comes in, not quite happy with this, not quite, no big deal, no arguments, no nothing. You scan them. It literally takes 3 minutes. That's it. And then you send it in.
Right.
I mean,
Exactly.
if you're serious about aligner therapy, you need to get a scanner.
Yeah.
Then a lot of guys use cone beams. I don't have a cone beam in my office, but frequently I'll send them out. My buddy is right down the block, and he does the cone beam for me. And that's another advantage in this process. So the digital workflow, I mean, I have a 3D X-ray machine, of course. I got rid of my old filmer a long time ago. So I have a 3D that, which makes it easy too. Most of my patients just need a Panorex and a Ceph.
Right. Right.
But the cone
But
beam,
I love your analogy on that of driving west and taking a new direction, and it's managing our expectations of what refinement is all about. So, you know, that's a tremendous analogy. When you are working with your referring docs, what technology do you want them to have? They're sending you a case. Is there any of the new or the coming technology that would make your diagnostics, but also the execution on your cases better from your referring dentist?
interesting when you talk about referring dentists. Back 20 years ago, it was a one-way street. Basically, your GPs referred to you. If you could get a patient in the office who doesn't have a dentist, then rarely you could refer back to the GPs. But the GPs basically referred their patients to me. Things have changed over the years, and that's okay. The GPs are doing a lot of aligner therapy, and that's okay. I mean, it is what it is, but the GPs are doing it. They have every right to do it. And I know lots of GPs that do aligner therapy as well as an average orthodontist. I do. But anyway, so now my GP friends are still referring tough cases to me, but they're asking me for help on their easy cases. And that's great. So what I want, ideally, they would have a scanner. Ideally, because then what happens is with Reveal, they can send me the scan that they send to Reveal. So whether they send it to Reveal, a digital impression or a PVS impression, Reveal then comes up with the treatment plan in the digital mode. And with Reveal and with some of the other products, it's easy for them to click on it and send me a copy. So I can get on the phone with them and explain to them, oh, I don't think you should move this tooth in this direction. I think this one's, look what they're doing here. They're intruding a cuspid. Why would you want to intrude a cuspid? Tell them not to intrude the cuspid. And you could go back and forth and back and forth. And let me tell you, they appreciate it. And while if you're an orthodontist, we'd liked it better in the old days when general dentists didn't do orthodontics. No, it's different. Because now general dentists are diagnosing malocclusion much, much more. Back in the old days, they let them go. They used to look at lower anterior crowding as normal, and they wouldn't bring it up. They wouldn't say to their patient, "You have they just ignore it." Now they've noticed, they've learned how to diagnose malocclusion disorder. So I am getting today as many, if not more, referrals from my general dentist that I've ever gotten before.
That's first of all, that's amazing. I just want to say your point of view is such a expansive, much more positive point of view that we're not dealing with a zero-sum game. We're dealing with a more expansive game, because it's just to clarify, what you're doing is you're helping your referring dentist, the general dentist, to provide a higher level of care for those easier, let's call them the ortho type cosmetic cases. But then you are there for them for the more complicated malocclusion type of cases, and everybody's really winning. And I think that's really noteworthy for you to take on that role as literally as an orthodontic colleague advisor for these general dentists to be able to facilitate that treatment. So I think that's amazing. And let's talk technology for a second. If you, in a perfect world, if you had a new technology that came out that allowed you this collaborative approach with your referring dentists, what would it be? Would it be the ability to, have better data capture on a platform that you can all share? Maybe we have that already. Would it be AI driven? I mean, thinking completely out of the box, the relationship of your referring docs, doing some ortho and even other disciplines, what can technology do for us to even make us better than we are today?
Give me a sort of Zoom treatment plan. In other words, right now, the general dentist sends me the link, and I can get the treatment plan up on my computer while he gets the treatment plan up on his computer. But it's my treatment plan and his treatment plan. How about some sort of Zoom link here where we're both seeing the same thing, and I can move the teeth a little bit, and as I move the teeth on my computer, they move on his computer, and then he can enlarge or move the teeth that way. So we're both handling the same patient at the same time, and at the same time being able to click up x-rays perhaps at the same time. So it's sort of a Zoom sort of. We could do Zoom, but then I have my computer, his a combined Zoom where we can both touch the same treatment plan at the same time. That would be terrific.
A streaming service with real-time diagnostic tools to allow you to share images and create this amazing collaboration together.
Absolutely.
Bam, that's innovation. Doesn't exist yet. And anybody listening to you right now, I think you've given them an amazing idea, David. This was a really fantastic conversation. As a prosthodontist and working with specialists in the practice, I understand your background, understand your vision and how you work together to help your referring dentists and help your patients. Thank you so much for joining us here at Thrive Live. It's been an honor and a pleasure to be able to ask you some of these questions and to get your insights.
Thanks a lot.
Thank you. Thank you, David. Thank you so much.
You're welcome.
All righty.